Congratulations! You're either expecting or you just recently had a baby. Let's jump into some tips to help you prepare for how to best feed your baby during the first few days of life. Now, this short video is by no means intended to substitute for advice from a lactation consultant, but it is just a couple of tips to help you get through the next few days while you're waiting for an appointment. So book your appointment right now. We'll be covering how to maximize your milk supply, how to ensure your baby's getting enough breast milk, what to do if your baby won't latch well, what to do if your baby won't stay awake to nurse, and tips to prevent mastitis. Now let's start off with how to maximize your milk supply. The most important thing you can do the first day, 2-3 days of life is to get colostrum out of the breasts. And the best way to do that is by using 3 simple tools and steps, and the first one is to use heat on the breasts. Step number 2 to maximizing your milk supply is to use hand massage. This is so important because a pump can never substitute. I want you to envision the colostrum that's in your breast during the first few days of life to be a thick substance, like a thick wax. And the wax needs heat to be applied to the breast first to soften it. And the only way it's coming out is by you using your hands and hand massaging the colostrum out. And the third and most important step to maximizing your milk production during the first few days of life is hand expression. Hand expression is the best and most effective way to remove colostrum out so you can feed it to your baby. A pump may not be able to get out the colostrum, so it's super important that you learn how to hand express. I am writing a link to a website that does a fantastic job teaching you how to hand express during those first few days of life and how to feed it to your baby. In summary, to maximize your milk production during the first few days of life, applying heat to the breast, massaging the breast, and hand expressing colostrum out is imperative to your long-term milk production. There are many studies showing that the amount of colostrum you are able to effectively remove from the breast during the first few days of life have a direct correlation to your long-term milk production. So it is imperative that you do not let your breast become hardened or engorged without relief during this first week of life, especially during the first 3 days of life. Your number one priority, of course, is to be safe, but to get colostrum out of the breast as frequently as possible, which can be anywhere between 8 to 12 times a day. Let's talk about feeding your baby during the first few days of life. It's very important that you offer your baby very small servings of breast milk or colostrum during the first few days of life. This can be up to 10 to 12 times per day per 24 hours. During the first 1 to 2 days of life, because your baby will only require about a teaspoon 8 to 12 times a day, it is perfectly acceptable to offer breast milk in a teaspoon or in a small cup like a medicine cup. It can be very difficult for your baby to stay awake and have the stamina to latch and maintain the latch the first few days of life. So do not get stressed out. The most important thing is that you feed your baby your breast milk, and using a plastic clean spoon or a medicine cup will do the trick, and I will link some videos in the comments or in the bio so that you can learn how to do that safely. Beginning at about day 3, your baby will require about 3/4 of an ounce to an ounce of breast milk 8 to 12 times per day. That's about the size of a walnut. It is typical between day 3 and 5 for women to notice their milk volume increase. It's also very important during this period that you keep a strict record on the diaper count of your baby. So count the number of urine diapers and the amount of bowel movement diapers, and follow your pediatrician's recommendations. But generally speaking, we want to see 1 wet diaper for the first day of life, and if it's your baby's 3 days old, we want to see at least 3 wet diapers, and stool will be very variable. Now let's take a moment to pause here and revisit some of the original questions that would be addressed in this video. We've already addressed how to maximize your milk supply, and now I want to discuss how to make sure your baby's getting enough breast milk. What do you do if your baby won't latch? And what do I do if he won't stay awake to nurse? Well, hand expression, frequent draining of the breast, feeding your baby your colostrum and your early transitional milk with a spoon or with a small medicine cup are all ways to ensure that your baby is going to be getting enough milk. You also want to keep a strict record of their diapers, and you want to count them to make sure that they're producing enough urine. And these tips will help you until you're able to meet with your pediatrician or your lactation consultant. Now let's talk about ways to prevent getting mastitis. Mastitis is super painful. It can cause a fever, give you body aches and chills, and no one wants to get mastitis. If left untreated, it can cause you to be hospitalized for treatment. Tips to prevent mastitis. Let's prevent engorgement, hardening of the breasts, tenderness of the breasts, or overfilled breasts. These things can lead to mastitis if not handled quickly. Another way to prevent mastitis is to prevent powering through painful latches. If your baby latches and you want to curl your toes and cringe because it hurts so much, stop directly nursing. There's no need for this. If you're having scabbing, any injury to the breast, any open wounds to the breast, you want to stop directly nursing. I drew a picture of a little shark here because I often call babies who cause their moms pain when latching baby sharks, because that's what it can feel like. That's how much pain it can feel like. So do not tolerate latches that are painful and causing any kind of nipple damage. The reason overfilled and engorged breasts as well as nipple damage can lead to mastitis is because that is a perfect breeding ground for harmful bacteria to grow and enter the nipple and milk ducts. And so you'll see in this illustration, there's a picture of a couple different bacteria here. And when your infant is causing creasing, cracking, scabbing, bleeding of the nipples, it is a perfect way for the good bacteria to mix with the bad bacteria and the bad bacteria to get into the breasts. In the same way, keeping the breast filled with milk because of engorgement, because your baby's not removing the milk for sleepiness or for any reason, is basically letting milk, like say on the kitchen counter, and it spoils and can become sour. And so if you're keeping milk in the breast for days and days and they're becoming full and hard, this is a perfect environment for these bacteria to make a home and cause mastitis. Okay, now you're home and it's day 2 or 3 and you thought things were going great, and so you didn't call a lactation consultant, but now your baby is kind of sleeping through feeds. You're starting to get nipple pain and some damage, and you're not sure how to feed your baby now. Maybe she's looking a little bit yellow. Maybe the pediatrician is telling you that she may have lost too much weight. Don't fret. Remember to express that milk out of the breasts. You can totally cup feed. And if you're giving your baby more than 1 to 2 ounces and you would like to use a bottle, don't fret. You can use a bottle in a manner that complements breastfeeding. And I will link an article on our blog that discusses how to pace bottle feed your baby. If you need help now and you do not have time or energy to look at blog articles and read things, let's try and get you set up with a virtual appointment to help troubleshoot what's going on until we can see you in person. So give us a call at Milk or go online and schedule a virtual appointment at milkdiva.com. We accept several insurance plans. Okay, let's talk about some free resources. The first resource you can go to is milkdiva.com/blog. We have blog articles about will introducing a bottle interrupt breastfeeding. We have articles about increasing your milk supply, how to properly fit your pump flange, when to start pumping, breastfeeding with breast augmentation, sleep training, and breastfeeding. So tons of free information over there. The next free resource is our survival guide for expecting moms, 10 common breastfeeding pitfalls to avoid. Another amazing free resource is a website from a pediatrician and an IBCLC called firstdroplets.com. Global Health Media is another amazing resource to learn how to feed preemie babies, anyone who may need to benefit from spoon or cup feeding, and it is completely free. And lastly, there's a ton of free information on any of our social media channels. We as Milk Diva look forward to serving you, and please feel free to visit our website and book an appointment with any one of our wonderful qualified lactation consultants.